final slide, next slide please, shows the number of people who have sadly lost their lives. And this number stands at 40,261 on the latest information, which is 357 higher than yesterday. As the NHS reopens right across the country, it's critically important to stop the spread amongst staff, patients and visitors too. So today we're setting out that all hospital visitors and outpatients will need to wear face coverings. One of the things that we've learned is that those in hospital, those who are working in hospital, are more likely to catch coronavirus, whether they work in a clinical setting or not. And so to offer even greater protection, we're also providing new guidance for NHS staff in England, which will come into force again on the 15th of June. And all hospital staff will be required to wear type 1 or 2 surgical masks. And this will cover all staff working in hospital. It'll apply at all times, not just when they're doing the life-saving work on the front line. It'll apply in all areas except those areas designated as COVID-secure workplaces. And of course, where the PPE guidance recommends more stringent protection, of course that remains in place. Like so many, I'm appalled by the death of George Floyd, and I understand why people are deeply upset. But we're still facing a health crisis, and coronavirus remains a real threat. And the reason that it's vital that people stick to the rules this weekend is to protect themselves and their family from this horrific disease. So please, for the safety of your loved ones, do not attend large gatherings, including demonstrations of more than 6 people. We all need to stay alert, control the virus, and save lives.
Could you explain to people what if there is a different R rate in the community as opposed to in hospitals and care homes?
Of course, there is a higher incidence of new cases amongst health staff and social care staff. That is shown up in all of the studies. But that is not rising as a proportion, and that implies that there isn't a different R, so to speak, in health and in social care. But the measures that you take in health, in the NHS and in social care are different. Hence, we have a whole package of work to bear down on the disease in social care, and at the same time, a huge package of work that's being undertaken by the NHS in order to get the transmission of coronavirus in hospitals right down. And it's that latter one that we're publishing more information on, and where we're strengthening the rules around face masks and face coverings in hospitals.